thank you all for being here. Thank you to the World Federation for having this Canadian panel this afternoon. And I really want to give a special thanks and acknowledgement to Deborah for sharing Brittany's stories and the other stories that she brought forward this morning and grounding us in the really important discussions we're going to continue to have today, tomorrow, and forward. So, Dying with Dignity Canada, we've been on the assisted dying file for 38 years now, and I'm really proud to say that in 1980, we were a founding member of the World Federation of Right to Die Societies. And for 32 of those 38 years, we lobbied singularly for comprehensive federal legislation for assisted dying. And I would say normally, be careful what you wish for, but I realized that satisfaction in assisted dying can be very relative. Our organization doesn't believe that our federal legislation went far enough, but certainly when I look around the room and hear that the road to realization is still unrealized for so many countries, provinces, and states, that I should be quite satisfied. And I would also like to acknowledge that even though we don't think our legislation has gone far enough, for the thousands of people in Canada who've been able to access an assisted death, absolutely it went far enough for them. So we are the go-to national human rights organization for assisted dying and end-of-life rights, and our work is informed by our Clinicians Advisory Committee, our Disability Advisory Committee, and now in the post-Bill C-14 era, Bill C-14 is our federal legislation, our Legal Advisory Committee, and absolutely by the Canadian public. I'm going to speak with you today about the advocacy framework that we use in advocating for assisted dying, the eligibility criteria issues that are outstanding, access issues that are still ongoing, and other end-of-life right issues. So, we use a human rights lens, and I was so pleased when I saw the tagline for this conference, #assisted dying, our new human right in the 21st century. But I do understand there's a debate tomorrow on whether assisted dying is indeed a human right. I think there might be times when we think that human rights are relative to space and time, but the beauty about human rights is that they are timeless and they are always relevant. So why do we use a human rights framework? And quite honestly, as a human rights activist, which that's my professional background, I can't imagine any other way to discuss this issue and to move other issues forward. Last summer, I had an interview with a Canadian magazine reporter, and she was interviewing about the poor rates of compensation for clinicians in the province of British Columbia, where my fellow 3 doctor colleagues are all from. And she was really curious about why Dying with Dignity Canada was advocating for a fair fee structure. And so I told her that, the answer is really simple. We advocate and we support the person. And then I talked about the human rights lens that we use. And so if there's something that affects the person, the patient, negatively or even positively, then we're going to speak out, we're going to campaign, and we're going to support and participate in court challenges if that's what it takes to ensure that justice is equitable throughout the country. Because if you don't pay the clinicians well who do this important and sensitive work, then no one's going to want to do this work, and people aren't going to be able to get the help that they need. And so then she became very curious about our organization and what it means to use a human rights lens in our work. And so we spoke a lot about the work that we do. We participate in court challenges to Bill C-14 so we can go back and get the eligibility criteria from the Supreme Court of Canada's decision in Carter, which led to the assisted dying legislation. We don't think that the legislation as it exists is constitutional, and we also think that it violates the rights of many people with chronic illnesses who could live for a number of decades. We want to ensure that people with dementia or other capacity-eroding conditions are able to make an advance request for medical assistance in dying, something that's currently not allowed. We want to ensure that the minimum standards for clinicians who have a moral or conscious objection to assessing or providing assisted dying, that at the very least, they must provide an effective referral so people can get the help that they need in a timely fashion. And we expose publicly funded healthcare facilities all across the country who opt out of providing basic and essential healthcare. Canada has a single-payer healthcare system. We believe that we have universal access to healthcare, but there are a number of hospitals, hospices, and long-term care homes who receive public funds Many, but not all, are faith-based, have decided to implement a system of forced transfers, forcing the most vulnerable and frail to leave those facilities in order to access their legal right to assisted dying. Those 4 issues all engage our Charter of Rights and Freedoms in Canada, and it was the very charter that led to assisted dying being allowed in our country. But we do other things. We facilitate clinician-led, by Dr. Ellen Wiebe, case-sharing webinars for clinicians across the country, and we provide emotional support and patient navigation through our personal support program. So why do we do this? Because we want to put the person first. And what does that mean, and why does that make what we do so special? And for us, the answer again is also very simple, that when we're talking about medical assistance in dying, we're talking about a new and fundamental human right in our country. And it's one of the most important human rights developments in the last 50 years. We look to the same international mechanisms that people who work on reproductive rights and rights for people to healthcare in the queer community look to. The Universal Declaration of Human Rights, the Covenant on Economic, Social, and Cultural Rights, and nationally, we look to the Charter of Rights and Freedoms. And yes, the international mechanisms do not specifically talk about assisted dying, but the principles are the same. We're talking about choice, autonomy, grave suffering, and really, that we're the only ones who can decide for ourselves what we want done with our bodies. Now, I was at a conference a couple years ago, and I was on a panel with a palliative care doctor who really didn't support assisted dying at all, and was talking about our human rights lens that we use. And he said, "Oh my, Dying with Dignity Canada, you're so clever to talk about human rights and assisted dying. If you want to talk about human rights, let's talk about palliative care." And so I asked him, well, why don't you? Why don't you talk about palliative care as a human right? Because, spoiler alert, healthcare is a human right, which makes palliative care a human right, which makes medical assistance in dying a human right. Because when we focus on the person, in this case, the patient, that frail and vulnerable person who's seeking access to relieve themselves of the intolerable suffering that they have, then all of the noise falls to the wayside and we can really move forward with person-centered care. In February of 2015, when the Supreme Court of Canada came down with the Carter decision that allowed assisted dying, it unleashed a gigantic iceberg that continues to transform our medical, social, legal landscapes in our country. And the thing about icebergs is that, when you see them in their natural environment with lots of water and ice, the one thing you can't tell is, 1, how big that thing is, because you're only seeing the tip of it on the top, and 2, how fast that thing is moving until it shows up off the coast of Newfoundland, and everybody asks, just how did that get there? And the other thing that the Carter decision gave us, it gave us a line in the sand that we're all now standing at together. I'm so proud that Dying with Dignity Canada stood out there at that imagined yet aspirational line for over 32 years before we and the rest of the country knew what you all know. We are standing on the right side of history. You know that. You've been standing at that line with us. And with any rights-based movement, it takes a spectrum of actors and organizations to hold that line and to move it forwards. Organizations like the Canadian Association of MAID Assessors and Providers can bring a lot of legitimacy and credibility to the practice of medical assistance in dying. Other actors on that spectrum, though, may make us feel uncomfortable. Last year, we called for Stories for Canadians to support our official submission to the Canadian Council of Academies, a research body that's been tasked by the federal government to study advance requests for people with dementia, mature minors, mental illness, and assisted dying. We were stunned by the outpouring that we received. One of the many heartbreaking stories that we heard was from a woman whose partner was diagnosed with early onset dementia. And he was unable to, at that time, to access an assisted death, and he knew what was going to come for him, and it wasn't going to be pretty. So last August, he died alone, without family or friends, because he was just terrified of what was going to happen next. These stories of unnecessary suffering and overwhelming grief challenge us all to look inwards and to reflect deeply on our own discomfort. Other actors on the spectrum, like Adam Meyer Clayton, made many of us feel uncomfortable. He was a young man, I think he was 27. He wanted to have an assisted death in Canada. He suffered from mental illness, and his suffering for him was intolerable. He was handsome, he was smart, he was really articulate. And when he killed himself in 2017, he challenged us all to look at inwards and ask ourselves as a society, is it okay to discriminate because we are uncomfortable? The conversations that are related to advanced requests for dementia, for mental illness as a sole underlying criteria, and for mature minors are ultimately about our society's appetite to justify discrimination because these issues make the rest of us a little bit queasy. I believe that those issues have to come, as the original assisted dying debate in Canada did come, from a place of discomfort. These sad stories, what Deborah shared with us this morning, they provide us with a valuable entry point into difficult conversations so that we can have thoughtful, reasoned, and compassionate dialogue to move that conversation and hold that line or push it forward. So I say, yes, talking about death, dying, and assisted dying can indeed be uncomfortable. Let's own that discomfort and invite others into a safe space of shared unease so we can all be better prepared to deal with the inevitable. Because there's one thing I can guarantee you, and we've heard this morning, the people on the other side of the line. They were there before there was a line, they're there now, they're doing everything possible in every jurisdiction to push back or prevent assisted dying from being realized. They're well-funded, they are well-networked, and they're afraid. They're very afraid. Fear is the currency that they trade and organize in. It's our jobs to demystify that currency and to bring evidence-based research of the practice and provision of MAID in our country to tell the powerful stories of those who benefited from a peaceful death and to advocate for the person who also has fear. Fear that they have a life left to live with enduring and intolerable suffering. Fear that they won't be able to get the help that they need and they're going to fall through the cracks, and fear that they will be judged for exercising their legal right and human right to an assisted death. So, moving right along, I stole the name of this next slide, Medical Assistance in Dying and Working on the Edge, from Dr. Ellen Weeb. She's organizing an international roundtable next year looking at working on the edge. And it made me stop and think, what does that really mean for an organization like ours, for all of yours, that have been working on the edge for decades? I think it could mean that when you advocate for human rights and medical assistance in dying, you get to dream big. Because the edge always leads, spatially and conceptually, if we allow it. And so we can use the edge, and sometimes it's the thin edge of the wedge that can drive a door open, wide open, and then all sorts of other good things can happen on the areas that we work on. So what do I mean by that? And I think you probably all have examples in your countries that in Canada, sadly, it took a debate on assisted dying to bring some light and the light of day to discussions around palliative care and the problems that people have accessing good palliative care. So we can leverage assisted dying for better access to healthcare for more people. But what else can we leverage while we're at it, while we're working on assisted dying? In the spring of 2016, when we started hearing about the number of publicly funded health institutions that were going to opt out of providing MAID, I thought to myself, we need to have a legal challenge. Except I went to a number of lawyers, and they all said the same thing to me. Well, you know, Shanaaz, it's going to be very different, very difficult to do, very, very difficult. No, there's no legal right to health care in Canada, which came as a bit of a shock to me because I was one of those children that grew up believing we had universal access to health care. And so I mulled on that for a bit, and then I thought, wait a second. There is only one type of health care in Canada where it's got the weight of a Supreme Court decision, it's got federal legislation legalizing assisted dying, and it's an insured service in every province and territory, and that is medical assistance in dying. Instead of telling me that we don't have a legal right to health care, what if, in working to ensure that the most vulnerable people have access to health care in their hospitals and hospices in their communities, we could establish a legal right to health care. What would that mean for women looking for help in terms of reproductive care? What would that mean for people in the LGBTQI community, especially teenagers looking to transition? What will that mean for people in our federal prison population? It means we can use assisted dying and we can get a legal right because the edge always leads. And so, like it or not, if those of you in this audience, the lawyers, the doctors, the academics, and the activists, you may not want the title of a human rights activist. However, you should know, if you're working in medical, legal, political, social landscapes, that you are standing there with us at that line, and that we together, domestically in Canada and internationally at events like this and in solidarity, can move collective lines forward. I invite all of you to own your space at that line so that we can make sure that people all around the world who have intolerable and enduring suffering can find the option of an assisted death. And for those of you who are in jurisdictions where assisted dying isn't currently allowed, I think there's a greater onus to really use a human rights framework, because human rights are universal, they are inalienable, and they are indivisible. So speaking and supporting what Deborah said earlier today, because you live in a place that doesn't have assisted dying, it doesn't mean you don't have the right to assisted dying. It just means it hasn't been realized yet. Dream big, my friends.